Yes, my people, welcome to the chat today. It's been a request. We do an overview of infertility before we go in details of the topic that we started. Now, infertility has a meaning, and we both understand that. That staying without getting a kid for some period may not be infertility, and we really need to understand what infertility is. Because generally not getting a kid does not mean that you are infertile. It may be for a period, or it may be because of environmental factors, or other factors maybe that may be coming up causing you not to conceive. And you see, infertility may be in both men and women. It's not only in men or in women. In African culture, men at times don't agree that they can be infertile. And it leads to women being subjected to trauma when they are not having the problem. Now, today we are going to talk about infertility, and we will look and see what infertility is. We learn about infertility again. Now, infertility is defined as the inability of a couple to achieve pregnancy. Inability of a couple, inability of a couple to achieve pregnancy after 12 months of regular and protected sexual intercourse. 12 months. It can be due to factors from the man or at times from the woman. You understand? Both of them can be the cause of this infertility. So, for the woman, may be the cause of the man. Now, let's get down to what can make someone not to conceive or be impotent. At times, I don't like using that word, but you see, it's the word that is it is the word that is used to say that you are infertile. Many people undergo this and they are so stressed about being not able to conceive. Now, we will start with a man, then we go to a woman, because you see, this is a couple. A couple means either a man or the woman has the problem. Now, the male factors are several. The male factors are several that can lead to a man not to get to be able to give egg or conception to happen. We start with what can happen. Male infertility in nowadays, they contribute 30 to 40% of cases of men. Imagine, main causes involve sperm production, function, or delivery. There are three: sperm production, function, or delivery. So, what is the problem when it comes to sperm production in a man? In a man, it means there is maybe a genetic disorder. There are some genetic disorders in the testicles, where when the testicles come up, you understand, when someone is developing and then you get a genetic disorder. Some of the disorders are characterized like Klinefelter syndrome, mm, the Y chromosome. mm, you get it. Plus, it increases, and then the testicle is not normal. So this happens that the sperm production may be low or inadequate. And then there is cryptorchidism. Cryptorchidism means and descended testes. You see the work of the testes when storing the sperms. Now, if they have not descended, there will be a problem in producing the sperms. And then we have varicocele. Varicocele, varicocele are veins that are dilated testicular veins. When the testicles are dilated, it means what? The sperm's production has a problem. You see, these are factors that are affecting a man. And then we have another one called testicular trauma or torsion. Maybe a man you got an accident or there is torsion. Torsion means maybe strangulation. They have twisted and then they are dying off. You see, there are other factors like infections. When you have sexual transmitted infections, UTI that are so bad, severe UTIs. Like we can get like mumps, orchitis, tuberculosis, sexually transmitted infections damaging the testes. And you know, the testis is the key player when it comes to storage and transportation of sperms. Now, these are causes that are limited to sperm production problems in a man. And then we have radio or chemotherapy. When you are subjected to radiotherapy or chemotherapy, at times it may bring problems. You understand. At times it may bring problems because you know when some people are undergoing cancer, they may be cancers, some types of cancers, they may be subjected to radiotherapy or they may be subjected to chemotherapy. And you see, this can destroy the testes. The testes in a man is a very big thing that leads to infertility if it is not taken care of. You see? So in the testes, we are limited to sperm production. But there are others that in a man can affect, not just the testicular way or the sperm production way. We have another one called the hormonal disorder. This one is before the testes, before the sperms gets to the testes. Hormonal disorder. Hmm? After regulations of sperm production, you'll get hypogonadotropic hypogonadism. This means low hormones like follicle stimulating hormone, luteinizing hormone, and testosterone. These are the main causes. If you really need to go back to the video that I was talking about these three hormones, the follicle stimulating hormone, the luteinizing hormone, and the testosterone hormone. You understand? Very important when it comes to production of sperms and regulations of sperms. And then we have another one called pituitary tumors. So when you have pituitary tumors, prolactinoma and cranipharyngioma, those are tumors. They may disturb these hormones that regulate the normal regulation of hormones in your body. You see, this is a man, and the pituitary gland in the brain regulates all these hormones. So if there is a tumor, it can destroy it. And then we have hypo or hyperthyroidism. We brushed about thyroid somewhere in our videos, and we saw what is hypothyroidism and hyperthyroidism. So this one lies on hormones: hypogonadotropic, hypogonadism, pituitary tumors, thyroid diseases, adrenal disorders like Cushing syndrome. Adrenal disorders is when you have a problem when it comes to regulation of the body steroids, the corticosteroids of the body. You see, and then we go and see there is another one, the type C, where we started with sperm production, we went to hormonal disorder, and then now we are at a place called sperm transport problems. Because if the sperms are not transported, how will they go in to fuse? Congenital absence of vas difference seen in cystic fibrosis. The vas difference is a pipe that transports, it gives way for the sperms to go. Mm? So if there are some conditions like cystic fibrosis that you will feel this vas difference is not there. Our next lesson we will draw and see the parts of a male and a female genitals so that you may understand. And then we have obstruction from infection like epididymitis, that is pros- prosta- prostatitis, and then urethritis. These infections may cause a problem in the flow of the sperms. You get it? Sperm transport problems. We have vasectomy, surgical vasectomy. Now, when you do vasectomy now, you cut you understand, you are cutting the sperms from going in the penis and getting out to go to to fuse so that a woman can conceive. Vasectomy, you get it. Retrograde ejaculation. Semen goes in the bladder. You are ejaculating, but the semen is not coming out. It is going to the bladder. This is a problem. Maybe this person has diabetes because most cases in retrograde ejaculation, the problems are in the bladder and mostly at diabetics. Maybe you'll find someone had an accident or fell down and then has a spinal injury, or certain drugs may provoke retrograde ejaculation. We go on and we see there is here sperm function defects. Sperm function defects. Sperm function defects, we talk about abnormal motility, athenozospermia, abnormal motility, slow or fast, or they don't move because sperms have to flow to go to fuse so that you can get a zygote. You see, so they are not flowing. They don't have the energy and capacity to flow. We call it adenospermia. And then we have abnormal morphology, teratospermia, abnormal morphology. Low sperm count is a problem, or no azoospermia, oligospermia, and no azoospermia. And then we have lifestyle and environment factor, smoking, alcohol, drugs, anabolic steroids, cannabis, and cocaine. They make you lose the sight and even destroy the production of the sperms. See, this is a big problem. We go to the other one, which is excessive heat exposure. Excessive heat exposure, tight clothing, frequent hot bath, laptops on the lap destroys the sperms for men. So for men, tight clothing and tight pants, be careful about them when you are at the age of procrastination. Tight clothing, frequent hot baths. You see, the sperms need to be stored under certain temperature, that is your body temperature. So when you are increasing the body temperature around the pelvic region and then down there, you are destroying the sperms. That's why they like the energy to flow and go and fuse to produce babies. Obesity, big bodies without exercise and eating a lot of junk and carbs affects testosterone balance. Now, as a man, you see, testosterone is the main component of a man. But when it is destroyed, a problem comes in, impotence. So we check on those factors so much: lifestyle and environmental factors, exposure to toxins like pesticides, heavy metals, radiations, stress. Stress, we have just been having topics on mental health. We have just been having topics on mental health and we talked about stress and we know what stress can do, what stress can do to make a person be important. Now, we continue to the other factors now. We have divided the factors of a man into this. We have broken down them into the first one is sperm production. Yes, hi Wambo, welcome to the platform. Today we have a very short video of male factors of infertility. Male factors of infertility. Now main factors, not male. We have broken down them as sperm production problems, which may come as genetic disorders, hypokidism, varicocele, testicular trauma or torsion, infections, radiations, and chemotherapy. That is sperm production problems. And then we have gone to hormonal disorders, where hormonal disorders, we have looked at this hypogonadotropism and hypogonadism. We have seen pituitary tumors, thyroid diseases, adrenal disorders. That is dealing with hormone disorders in a man that can make a man not to produce babies. And then we have transport problems. That is C. Transport problems, we have congenital absence of the vas deferens. And we have said vas deferens is a tube or a pipe that makes the sperms to flow through. So if you don't have it, it will block the sperms. Obstruction from infections like epididymitis, prostatitis, and urethritis. Sexual transmitted infections may cause obstructions. Vasectomy. Vasectomy, you cut the vas deferens and you block the sperms from flowing. So that is a form of infertility. It is not reversible. We have retrograde ejaculation. People that are diabetic at times suffer most on retrograde ejaculation, and semen goes into the blood. We go to the last one, which is not the last one, the second last one, which we have talked about, the sperm function defects like abnormal motility, abnormal morphology. Morphology means abnormal shapes of sperms. Abnormal shapes of sperms that leads it cannot fuse with an egg of a woman and over to form a baby. Low sperm counts, people that have low sperm counts. And then we have lifestyle and environmental factors. Smoking, alcohol, drugs, anabolic steroids, cannabis, cocaine, this can lead you not to produce enough sperms. Excessive heat exposure. This is where we have talked about tight clothing in men. You put on tight clothing, body temperature rises, then it destroys your sperms. You check it. Obesity is a bad thing because affects the testosterone balance. And the main hormone of a man is testosterone. We have exposure to toxins like pesticides, heavy metals, radiations, and stress. Now, we go to the female. We have finished with factors of a male, but you remember we are still dealing with overviews. We are still dealing with the overviews of infertility, and you see, infertility is health-wise. It's in fertility issues. Infertility is the main program. When we're talking about fertility and health infertility, these are the topics that we are going to talk about. How the tissues around the pelvic region are affected, then you go infertile. Now, female factors of infertility, which are 40 to 50% female, 40 to 50%, you will get ovulatory disorders, tubular factors, uterine causes, cervical causes, and then we have other factors like age, lifestyle, and chronic. Now, in ovulatory disorders, we have several like polycystic ovarian syndromes, hormone imbalance, and anovulation. Now, what is polycystic ovarian syndrome in a woman? Polycystic ovarian syndrome is in the ovary, there are cysts. What is a cyst? A cyst is a pouch-like thing that is fluid-filled. The fluid inside is thick fluid, and you see when it can grow because of the fluid keeps on increasing. So poly means many. You get fluid filled with some thick fluid that are many inside the ovary. And this is where we say you have polycystic ovarian syndrome, ovary syndrome. It may lead to hormonal imbalance because anything that the body feels it's growing in the ovary or the uterus, it causes hormonal imbalance. That's why when you're pregnant, some hormones go up, like progesterone, and some goes down, and you cannot get menses when you're pregnant. So when you have multiple cysts in the ovary or in the uterus, there are some changes you undergo. Some people don't get even menses. You get it? So these are called ovulatory disorders because they tamper with the hormonal cycle. Hmm? And then the second one we have hypothalamic dysfunction. Hypothalamic dysfunction, stress, underweight, eating disorders, excessive exercise. This one reduces gonadotropic hormone, follicle stimulating hormone, and luteinizing hormone, hypothalamic dysfunctions. And then we have hyperprolactinemia. It suppresses prolactin is a hormone in a woman, but when it is when it is high, it suppresses gonadotropic hormone and ovulation. So you will not get ovulation. And you see, when you don't get ovulation, you have hormonal imbalance, fertility issues come in. You get it? Releasing the eggs that are supposed to be fertilized with the sperm becomes a problem. And then we have thyroid disorders, hypothyroidism and hyperthyroidism. Thyroid balances homeostasis, heat, balance in your body, sweating, you understand, water in your body. It even balances it works with the pituitary gland to see that the hormones are balancing well. But when you have problems with the thyroid, it may lead to infertility in a woman. You get it? When you have hypothyroidism, it may lead to infertility. Today is an overview. See, we have so many topics, and we are still giving overview since our last talk. And then we have the other one, thyroid premature ovarian insufficiency. Ovarian insufficiency. Hmm? You get early menopause before 40. That is called ovarian insufficiency. So when you get there, the problem becomes you cannot conceive normally when you're having regular sex in a woman. Now, those are we have dealt with ovulatory disorders. Ovulatory disorders when it comes to a woman. But the next one we see, it is tubular factors. The second one, tubular factors. Damage or blockage of fallopian tubes. Why this can happen? Tubular factors is damage or blockage of fallopian tubes. And why? Because this can happen. Pelvic inflammatory disease, usually from chlamydia and gonorrhea. When you have PID, if you have gone to hospital and you've been told you have PID, sometimes it's very painful. It can damage your fallopian tubes or it can block because of the bacteria eating and forming colonies. You get it? TB is another factor. And you see tuberculosis is a bacteria and it can cause the blockage of the tubes. You understand? It's a very important topic when you come to TB. TB doesn't affect the chest alone. It affects several parts of your body, including your back, your chest, your stomach, your gastric regions. Let me say that. TB affects all of this. Hmm? And then we have post-surgical adhesions. After ectopic pregnancy, surgery, appendectomy, you have been removed, you get some fibrous adhesions that are still there. They don't allow the sperms or the ova to penetrate through the, you get it? They don't allow, because sometimes when you are cut, you heal with a fibroid, something hard, and then it blocks the way because it was, maybe there was suturing when you are being repaired. This can be a problem. And at times, when we do surgical suturing, it is very important to do it well, because some people suffer because of these surgical procedures. We need to check the way we are dealing with surgical procedures. So we continue with endometriosis. Endometriosis, yes, is endometriosis is a factor in women that is very important. And sometimes people confuse endometriosis and endometritis. We have seen so many people suffering from endometriosis. What is endometriosis? You have to differentiate between endometritis and endometriosis. So, endometriosis is a chronic gynecological condition that resembles the endometrium. You see, listen, is chronic gynecological condition where tissue that resembles the endometrium lining grows outside the uterus. So you have another place that looks like the uterus, maybe in the lungs or somewhere else. This endometrial-like tissue still responds to hormone during menstrual cycle. So when it reaches the days of your menses, it reaches the day of your menses. As you get menses, the lining itself, maybe in the lungs or somewhere else, they respond to the normal, and then what happens is you receive the menses away from the uterus. So that is endometriosis. You get it? That is endometriosis. Now, we were on tubular factors in female. We have talked about tubular factors, TB, we have talked about TB, we have talked about endometriosis, but there is another factor we call uterine causes. Uterine causes, congenital malformation, hmm, septa uterus, biconjugate uterus. Those are funny shaped uterus that cannot hold a fetus. See, now we are at the uterine level. And then we have fibroids, especially submucosal. You know, fibroids are several, mucosal, submucosal, they are like four types, but submucosal mostly causes problems when it comes to conceiving and implantation. And then we have polyps. Polyps are things that grow inside the uterus. They look like fibroids, but they are not fibroids. Polyps. Intrauterine adhesions, Ashman's syndrome. Over there, you get it. Now, these are the problems that affect the woman in the uterus: uterine adhesions, endometrial polyps, fibroids, and congenital malformations. And then at the cervix, you remember I said the cervix is an opening, but it's a remarkable and has a significance in a woman, just an opening. So in the cervix, we have insufficient cervical mucus after surgery due to hormonal issues. Hmm? The mucus there is not enough. It doesn't allow penetration. You know, when there is mucus, the opening is is open a bit and it's not only closed. You get it? Cervical stenosis. The cervix is too tight. It can't allow anything to get inside. Anti-sperm antibiotics in the mucus, in cervical mucus. Anti-sperm antibodies. Antibodies of a person that kills the sperms. You get it? Those are the factors that may happen between a man and a woman that may cause you to be infertile. Other factors like age At 35, due to reduced ovarian reserve and egg quality. Hmm? After 35 years, that is given. Lifestyle, we have talked about smoking, alcohol, obesity, malnutrition, excess exercise. You see, chronic illnesses like diabetes, autoimmune disorders like lupus, thyroid. Autoimmune disorders are factors in your body that are destroying your own cells. There's your other cells of your body feels that your body has a problem and they are fighting against them. Autoimmune. They are not programmed. They just start. It's not like a bacterial infection that comes in and then it starts fighting for the other. You see, hmm? Chronic illnesses, diabetes. Diabetes. I wish we could get how to replace insulin without injecting someone. This could be a very big breakthrough. Now, both partners have contributing factors. You get it? As per what we have learned. You've seen infertility is not only in a man only or a woman. Both have problems on their own. So I've this review today, which is very short, I've just come out with it because so when we will be talking about a specific thing, you see, in a male, we have talked about sperm production, hormonal disorder, sperm transport problems. Sperm transport problems is a problem. Yeah? Sperm functions, the sperm itself, lifestyle, you yourself, how you get in and destroy yourself by smoking, alcohol, drugs, excessive heat exposure. You get it. In a female, ovulatory disorders, tubular factors, uterine causes, cervical causes. Those are problems. And other factors that we have talked about, like age. Thank you so much for tuning in for this quick update because sometimes we may start having some topics and then someone asks so many different questions. But when you review such kind of videos, you may answer yourself some questions. For all that have been in the chat, thank you so much. We will meet next time. Kudos. Be blessed, everyone.